thank you all for being here. Hope everyone is doing well and been staying cool the last week or two. Why don't we go ahead and call the meeting to order. Penny, if you could help the roll call, please.
Okay, Dr. Smith?
I'm here.
Dr. McBride?
Here.
Reverend Duvall?
Here.
Dr. Garza? I do not see him.
He's not going to be here.
Or Ms. Lee, I don't see her either. Ms. Lee? Dr. Khan?
Here.
And Dr. Huebner?
Here.
Thank you. We have a quorum.
Thank you very much. Let's start out. The first item of business is the approval of the corrected April 23rd minutes and the May 28th minutes. I know there were originally some concerns about the April minutes. Are those concerns mollified, or is there anyone who still has concerns about the April minutes? Okay, I think they adequately reflect the issue that was raised. So I would move for approval of the April and May meeting minutes. Is there any discussion on the motion? I did not get a second for that. Is there a second for that, for my motion?
Second.
Thank you. Dr. Huebner.
Thank you.
So hearing no discussion, Penny?
Dr. Smith?
Aye.
Dr. McBride?
Aye.
Reverend Duvall?
Aye.
Dr. Khan?
Aye.
And Dr. Huebner?
Aye.
Thank you. Thank you. Okay, the next item of business is the item that had constituted the concerns regarding the minutes from April, and that is requests from St. Louis City around resident transfers. Obviously, this has probably been the thing that has been most in the news related to our facility in the last month or two since Mayor Jones's election. And I know there were, we expressed some pretty serious concerns over the course of the last couple meetings about this. And so there was a desire, I think a general desire on the board, specifically raised by Reverend Duvall, to request that we hear more about any ongoing conversations that are taking place. Can you shed any light on it, Doug?
There has not been any additional communication between myself or anyone at Justice Services and the city for the last, I'd say, 2 weeks. Initially, we did receive we had 4 calls regarding the potential of us accepting people, and we explained on each occasion that we are not staffed up and cannot do so. And that's where it stays, and we're still not staffed up. Before we could even discuss taking anyone, we need to get program up and going. So I don't see the possibility of us taking city residents anytime soon.
Are there any questions from the board? Okay. Thank you for clarifying that. I guess we'll file that under the category of don't believe everything you read in the newspaper. Okay. If there's nothing else on that topic, then we will move on and get a hiring update. I know there have been kind of glimmers of hope around hiring, and we're in the midst of a new hiring fair going on today. Can you guys give us an update on that?
We hope to have 7 people come in Monday to begin a new class of recruits, 7 potential new officers, which is really good. That's the largest incoming class that we've had in several months. We have a mass hiring event taking place today and yesterday where potential applicants are being screened, interviewed, where we're just trying to get everything done quickly and hope to have some more come out of that. Part of those include a group of people who are interested in part-time only positions for third shift. We have some people that we have found that do not want to come to work here full-time because they have other jobs but are interested in part-time third shift work, so we've created a position for just those people. But we are seeing a little bit of an uptick in interest for the positions, and we're very excited about it and hope that all 7 show up on Monday. We had a group that recently completed the training, and in fact, Mr. Tony Weaver went through the training with everybody. And how many were in that group?
It was 5 of us total.
Right. And they are up now being mentored by correctional staff on the floors, and will continue to advance their careers, and they're all doing an excellent job, and we're very pleased with them.
Tony, can I give you a chance to talk a little bit about what that training entails?
Yeah, I would honestly say that I am a little disappointed in myself that I didn't go through it before. The responsibility of a correctional officer is massive. I had no idea all responsibilities that are included in their job. One of the things that where I was definitely grateful of how dedicated the employees are in spite of being short-staffed. And what I did find out is that I was under the assumption that once everybody when the resident went to the hospital, and they have a hospital post, I was under the assumption that the correctional officer was always armed, but I found out that is not the case. So they have told me some horror stories of some incidents that occurred while they were there with other extended family members that were incarcerated in the facility, and they were able to handle and diffuse the situation. So, but the training is, I would say, top-notch. You know, we have some dedicated on-the-job training employees that's ready to train new people as they come on board. So it's a pretty taxing position. It's a lot of work and a lot of responsibility being a correctional officer. So I am proud to say that I went through the training, and now I'm a lot more familiar with the process, which I think is very valuable.
Good. And good to see that, you know, members of the leadership team are going through the same kind of training and learning what it's like from the bottom up. So I think that's good. Any questions around hiring from any board members?
Jeff, if I could real quick.
Yes.
So from the minutes last time, on page 3, it said that we had a current deficit in terms of staff, about 25. Director Burris, is that right? So that these 7 would certainly not fill that gap. Am I reading that correctly?
That's correct, sir. And we had 2 resignations last week, 1 this week. So we're still treading water, even though I think we're getting a little bit ahead. But we are treading water.
Thank you.
And one of the things that we asked about in the past is getting a better understanding of the reasons for departures of the last 3 from the last couple of weeks. What did you hear back?
Shantae Hitchens, our HR department head, has sent out questionnaires to everyone that's left within the last year. Unfortunately, she's unscheduled off today. We were going to have her talk about that, but she's not available.
Okay. Can we have her to the next meeting?
Yes.
Okay. Okay, that would be good. Thank you. All right, we have a new face. Any other questions around hiring? Okay, we have a new face in the room today, and it's someone who Director Burris is pretty familiar with from previous work. But I want you to introduce Scott, but I also want you to talk about the process.
Okay.
And I know you had previous, relationship with 2 of the 3 finalists, and so can you explain exactly how you handled the process in light of that?
Right. When we opened up the Deputy Director of Administration position, there were 2 people on there who I'd worked with previous, so I thought it was appropriate for me to remove myself completely from the interview process, and I did exactly that. We took volunteers from line staff and a few members of the management staff, and had 2 series of interviews. And I'm very pleased to report that the candidate that was selected had his first day yesterday, and it's the man to my right here, Mr. Scott Anders. Scott had 23 years experience with the federal court. I have not worked with him for 3.5 years, but during the time I did work with him, I can tell you that I always found him to be fair, compassionate, and treat everyone extremely well. He's extremely smart. He's an Oxford scholar that attended college in Oxford, England. He also was responsible for funding and programming and multi-million-dollar grants, which this position we hope to tap into even more. Dr. Huebner had worked with him previously as well, but I'm very pleased to introduce you to Mr. Scott Anders, who is our new Deputy Director of Administration.
Thank you. Good morning, everyone. Good morning. I'm excited to be here and join the team. I'm just so impressed with what I've seen just yesterday, and I'm ready to get started.
All right. Thank you, Scott. And I was also a part of the hiring committee, and so I think the search committee, and so I hope others from the board will get involved and participate in future hiring committees. I think it's a really positive precedent that Director Burris has set here to include us, to have a voice in that process, and so it was good to get a chance to meet all the candidates, and it was a strong pool. So I was, encouraged by that and excited to work with you, Scott. Okay, we focus a lot of our time on negative things because, unfortunately, has been sort of the nature of our work the last couple of years is looking at problems and trying to solve problems. Once in a while, we do get to talk about some positive things. I think the next 2 items, well, the last item was positive, but I think the next couple items around communications and some changes to the pods are a couple positive things. So do you want to, Doug, give us an update?
Ray, can you show us that first slide, please?
Yes, I can.
We have a communications update going on where the video phones are being installed in each of the living quarters. Let's go to the second and third one, right? And this is the video phones that we now have in about a third of the pods, and within the next couple weeks, we'll have all the phones replaced with video phones. And in addition, they have some other options on there. And for instance, the law library is up and operating. And this has been a huge hit with the residents of the facility. They really enjoy them. And instead of having to schedule a weekly video connection, they're now going to be able to talk to their families daily through a video means. We're very, very excited about that. And even better is the very first slide, please, Ray. We have our tablets that are coming in. And each individual person that's housed at our facility will get one of these. And they'll be able to use this as a phone. They'll be able to use it for programming, job searching. There's music on them. There's books on them. There's movies on them. There'll be educational programming and other such things. But we're very, very happy that we've been walking around talking to the staff talking to the residents about these coming out. Each one does come with a set of headphones. There will be enough for every single resident. If people want one assigned to just them, the contract allows that for a $5 charge. They do not have a camera in them, but they can take them to their cells if they so choose. Okay, Ray, you can take that off, if you would, please. And this is just to show you, give you an idea of how big they actually are. They claim that they're pretty much destructive proof. I'm sure that will be put to the test eventually. But this is a very, very exciting time, and I shared with Jeff that I kind of feel like I know how it is to be Santa Claus now when I walked around to the residents and showed them all of this, because they were so happy and extremely excited. I missed out one of the big things. They'll now have access to email as well, be able to do email. And we anticipate releasing all these within the next 5 weeks.
Can you talk about the casing and the, what the firm that makes these has, because I've never seen these specific tablets. Is there a way, obviously you can never ensure that something isn't used as a weapon.
Right.
What about the casing can mitigate the potential harm, that could take place?
Yeah, there's some substantial medium to hard plastic covering on it that will absorb an impact pretty well. But I think, honestly, they could do more damage with one of the chairs that are in a living quarters than this. Securus is just promising that they don't have issues with any destruction of these, but we'll see with that. They are tamper-proof, where if you attempt to remove the casing, the system just totally shuts down, so we don't have to worry about them being tampered with either. There are facilities throughout the country that have utilized this. I was told that one facility in Tennessee, after they implemented them, the incidence of aggression and fighting dropped by over half because the residents were more involved in programming and other such things on the tablet. So we're across the board extremely happy that these are going to be in place.
So you can check me here because it's certainly your area of expertise and not mine, but my read of the scholarship on recidivism and what happens inside prison is that there's really only two things that researchers have shown can substantially reduce the likelihood of recidivism. The first is, I think, close contact with loved ones and community support during incarceration, and the second is educational advancement. Is that accurate?
I'm sure there's more than that, but I think those are, two really key factors. So I think that's where the tablets could come in. If I may, I do have a question, because one of the things that the researchers have found is that one of the barriers to this contact is cost. So could you talk a little bit about how much this costs to email people, anything like that, or any ways that we can help kind of facilitate this, or are the books for free? Any information on that would be helpful.
Yes, and in fact, I think that Tricia Rogers is on, and if she is, she can come in and speak about the exact amount. But this was one of the most exciting things to us. The communication price from our prior contract, where we only had handheld phones, wired phones, has actually gone down in price for the communication, even using the video method. The cost is actually less now per minute than it was under the old contract that we had utilized previously. And Ms. Rogers, I did not bring my sheet here with the prices on it. If you're on there, can you explain what the email cost is?
I am on. Yeah, email cost is 25 cents. We're providing a lot of free stuff, a lot of free books, a lot of free education, religion. Many things will be free. We're gonna have free movies and games. There'll be a cost for like premium content. And like if they want to send videos in or pictures, it's 25 cents also.
And the cost per call per minute is what now compared to what it was before?
It's 4.9 cents a minute, and it was 21 cents a minute.
That's positive. Can you talk about the monitoring? I know from a security perspective, there's got to be components in here that allows real-time monitoring of communication.
Well, correct me if I'm wrong, Ms. Rogers, but everything that's on here, we prove it in advance. They're not going to be able to get on the internet and seek information on things that would be inappropriate. Everything that we will review, anything that may go on there in advance before it's allowed to go on, correct?
Yes, That's correct. Everything that's going on the tablets, they won't be able to tamper, go on the internet or anything. Only everything we approve.
Okay. Are there other questions about the tablets?
Ms. Rogers, just super quickly, you could probably also explain that under the old contract, to accept money to even make a call, there was I forget what kind of fee it was called, but a taking your money fee.
Yes.
Where that's been eliminated as well.
Yes, we had funding fees, and every time a family member put money on our account, it was between $3.95 and $5.95. We have gotten rid of all funding fees. So we have 0 funding fees now for all accounts.
All right. When we first started, Tim and Phil, speak up if you guys remember this, but one of the first actions, I think, from the county executive's office was to direct this facility to not generate revenue from residents and their families. Do you have a sense? I guess we don't know exactly how much they will use different different components of this, but will we be aligned with that initial directive from 2 years ago that this would not be a revenue producer for county government?
Absolutely. The county will not receive, the county will not receive a single penny for any of the use of these items. The funding is for the organization that provides the service.
Okay. Okay, that makes sense. Are there other questions about the tablets? All right. Do you want to talk about the changes in the pods?
Right. I had what I thought was an excellent suggestion that I put up a box in each living quarters where the residents could write letters to me, and I'm the only one that have access to the key to get into those boxes, where I would go up twice a week to check for any letters in case they wanted to write me confidentially. We've reached out to our building superintendent, and he's in the process of seeing if there are any boxes that already exist, but has promised us that if there are not a method of doing that safely that already exists, he would construct such boxes to go on each living quarters.
Any questions? Okay. Now we have some not great news on the RFP. Doug?
The
Jeff,
RFP.
Director
Yeah.
Burris, just real quick before we move into this topic, I know the board's already aware, but we need to be mindful of the cone of silence in discussing substantive aspects of the RFP. But I think as long as we're discussing a sort of a timeline, I think we're probably in clear waters there.
Okay, so what can we share, Jake, that's appropriate under the cone of silence?
I think we need to avoid discussing specific vendors or bids or anything that could be perceived as favoring one particular vendor or bid. In the past, we've done sort of updates on where we're at in the process weeks-wise. Similar to what we're planning to discuss now, or?
Can we discuss the closing date and the number of bids received?
I think that's fine, yes.
Okay. We received, the bids closed Monday at 11 o'clock, and we received one proposal, excuse me. And that is being reviewed by procurement, I believe.
So I'm very concerned with that, and I haven't reviewed the proposal, but I'm concerned with the fact that there is only one proposal, and my gut feeling is that the board should probably request a reopening of the bid, and until we get a better selection of potential vendors. I'd like to hear from others on the board if there is interest in discussing, but I was really disappointed, and I'm not sure if there was something about the way that the RFP was written that discouraged people or daunted people, but I thought it was, I'm underwhelmed by the response. Any questions or feedback?
Since I've not gone through this process before, is it pretty common to get 5 or 6, or is this, is there anyone have experiences with this, or I'm fine with opening this up again, but I don't know what's common in terms of RFPs.
I think typically the wider net we've cast, the more bids we would get, and we did cast an extremely wide net this time, and that's why I think Jeff is so surprised that only one had come through. I'm wondering if it's because of the fact that there would be need for interviews and things along those lines that when this first went out and people started to work on it, COVID was still full swing. And if that discouraged some people going through it, and if that's the case, hopefully that would mean that should there be another such opening, that multiple people would want to submit proposals.
Doug, you're absolutely right. I just wanted to add that our experience with sort of the corrections marketplace, so to speak, for entities out there tells us that the number of players or companies or agencies out there is very finite in the space that want to dabble or associate or do business, etc. And over the last decade, a lot of them have either folded or merged. And so back to Beth's point, from the medical public health service perspective, it is not uncommon to receive only one or at the most 2 proposals. Regrettably, that is the shape and the way of things. I share your concern, Jeff. Ideally, we want at least 2, if not more, but that is the reality of things.
Yeah, there were at least 2 entities that told me they were very interested and were working on a proposal and then did not submit. So, and both of those I thought would have been, they were both entities that I was really looking forward to seeing what they were proposing. So, in any case, I think we will have to. I don't know if there's any other thoughts from the board before we move on.
Well, I want to key in, Jeff, to something you said about your concern of maybe how it was written. Since we can't go into any details like normal, we can never go into any details. What is the next steps? Are you saying now that since we only had one, that we're possibly going to delay and start over? I mean, what are we trending here?
I have to be honest with you, Phil. I don't know the procedure for reopening an RFP. I don't know. Jake, can you explain to us, or maybe we would need to have a representative from HR. I know Shantae is not here today, but Jake, are you familiar with the procedure for reopening an RFP, or what the mechanism would be to do so?
Honestly, not offhand. I figure it would have to go through procurement, and it's a pretty standardized process that applies throughout county departments. As far as reopening goes, I would need to take a look, and I'd be happy to do that after the meeting.
So why don't I do this, Phil? Why don't I connect with someone in procurement? Jake can review it from the legal end, and I will report back to the board next week on what next steps would be available for us to push for, because I'm not satisfied with with just having one bid to review, and maybe it is a function of the pandemic, and people reading about outbreaks in correctional facilities all over the country. Because we advertised this nationally, and I reached out to people around the country, people probably were not aware that we did such a great job in this facility of, mitigating COVID spread, and I'm sure reading headlines from other places may have been daunted, but yeah, I'm not happy with where we are, and this is not where I want to land, and so I will work with Jake and legal as well as HR and procurement and figure out what redress is available to the county and what the next most appropriate steps would be for the board to push for.
Jeff, I would like to add that when you're doing these or having these conversations, that you bring in Dr. McBride or Dr. Huebner, have somebody else on the advisory board with you with these conversations. The timeliness of this is unfortunate. All of what I'm hearing is deeply unfortunate. This has gone on way too long. There's been an appetite for this, and there were several justified reasons why we need this. And so to continue to keep it moving, not that I don't have the confidence in you, but let's have another advisory board member be a part of those discussions that you're having. Just so again, for some transparency, it's not just coming through you from them, but another party with you, if that's okay.
That'd be great. Is there another volunteer from the board who'd like to participate?
I had been hoping the chat was available, and it's not, so I'm not able to write things into the chat, but depending on the timing and all that, I think you had put me in charge of the RFP committee. Not that I've done a very good job with it, but if you need help, let me know.
I will loop you in, Tim, and I'll reach out to you right after this meeting, and we'll talk about next steps, okay?
Yeah.
Okay, thank you, Tim. Okay, if there's nothing else on that, which it doesn't seem like that's going to be a very fruitful line of inquiry today, but let's move on to the next item on the agenda, kind of a new innovation that you're doing here to try to get a better sense of what's going on on the floor, Doug.
Last week, I sent out an email to all staff announcing that I was setting aside 2 to 3 hours one day a week to have an opportunity to meet with the director one-on-one with just me and no one else. We had 5 people that signed up for the first one that took place this week. I found them extremely rewarding and informational. I found out also that I'm going to have to set aside a time for some different shifts as well, which I will do. But I think they've been well received, and I hope they continue. And like I said, I have personally learned from some of these. And in fact, the next thing that we have up on assessment changes, I'll just go ahead and go right into that, where I had some staff that were complaining there was no incentive to help train new staff. And because of that, many people were refusing to train staff. And the people that were doing it out of the goodness of their heart felt that they were being overutilized for this. So that and one other thing, I changed the assessments, the annual assessments for staff. One is there will be a section where people will be graded on how they helped new staff adapt to their positions as they come on board. And then secondly, for everyone that's in a sergeant and above position, there is a new, and this is effective just next week, there's a new section for anyone in a supervisory type position where they will be graded on how they have informed me of people who have excelled in their job or gone above and beyond. There was a complaint voiced by several people that we do a remarkable job of catching people when they're doing wrong, but we need to improve on recognizing people when they're doing right. And I think that is something that we need to make a priority. So those changes have been made on the assessments.
Any questions?
No, I'll just make a comment. Thank you, Doug. I find that these methods that you're implementing are going to be helpful when we talk about the culture and trying to change the attitudes and behaviors. So that's welcoming news. Thank you, sir.
Thank you. Okay, Doug, do you want to talk about the promotional opportunities open here?
Right. We have currently 3 lieutenant positions open and 1 captain position. Shante, before she took off, was not able to give me a number on sergeants. And we're holding off on scheduling interviews for these positions because when I first started here, one of the biggest complaints when we did the survey to all staff was they felt that promotions were not handled fairly. So we have formed a promotional committee that has met several times over the last few months. And we're scheduled to meet with them next month for what I understand are some concrete recommendations that they have. Mr. Weaver's the one who has ran that committee, and would you like to talk about that, please?
Sure. Yeah, I coordinated the committee. We have probably about 9 people, line officers on that committee, where they provided some great suggestions and modified and changed some qualifications for some of the lieutenants and captains' job description. So I think that was very, very powerful. And we got together and have a list of recommendations that we are going to be presenting to the director for him to approve to move forward, and something that we had communications with the deputy director was in the meeting as well. We went over and reviewed some of those items on there. So to get buy-in and support from the recommendations that were provided, we didn't have any pushback at all. And so I think this was a coordinated effort with the administration team as well as the line officers. So I think that's going to be a good way of moving forward.
And correct me if I'm wrong, you said to prepare for some recommendations about who they would like to see be on the interview teams, selection teams?
Yes, exactly. Exactly. They have a group of a set number of people that's going to be on the qualifications, the review team, because one of the things that they kept complaining about, it was the same people doing the same interviews each and every time. We have some questions that we're going to manipulate. It's not going to always be the same 8 questions. We got a series of 3 different set of questions we're going to be asking the people when they come in for interviews. So anybody have any questions in reference to any comments?
Well, Doug, thanks for having Tony Weaver, of all people, filling in for an HR capacity. That's a joke, Tony. Just being joking. But welcome aboard, Scott. I think as I had looked at the job description, I think that your role is going to be crucial. I'm always happy to see new faces at the table. It's a breath of fresh air, but I look forward to your assessment as to where we are and going forward. I think it's again, it's a positive step. So Scott, please, when reviewing these proposals and the process, please do your due diligence, because in order to change the culture, promotions at this point are vital. And as we really prepare, and I know I don't want to get ahead of Dr. Burtis, who's getting ready to talk about ABLE training. I listened, going back to Tony Weaver's comments about his experience while taking the class of correctional officers. I want to reiterate something that I shared with the city jail. The city is going through major problems. And what I said to the Board of Aldermen, the Public Safety Committee down in the city was, if we collectively don't get a better hold of training and positive reinforcement and fair and equitable promotions, we're not helping the culture. We're not moving it forward. We're just doing the same things with the same people and just putting on certain faces. I'm not interested in that. I'm interested in some deep dive of changing culture, of giving opportunities to people who want to get in this and make it a career, not just a job, where they're positive, where they're going to be willing. I mean, I think it's great, Doug, that you had to hear, hey, here's some assessments. How many people feel welcomed if people don't even want to train them when they come into a working environment such as serious as corrections? So with that said, I know I threw a little stuff at Tony. I applaud what the team is attempting to do, and I look forward, Scott, to you coming on board and helping us move forward. But Dr. Burrs, Mr. Burrs knows how passionate I am about the culture, about training, about leadership. And we're only going to do those things if we bring people in a more healthier environment that's supported, that has the proper tools, and we can give them as much as we can to assist them in keeping themselves safe as well as the inmates. Thank you.
Thank you, Phil. Okay, do you want to, that's a good segue to the ABLE training.
And I'm embarrassed to admit that I was not familiar with the ABLE training, but it was recommended to me, and looking into it, it's an exceptional opportunity. It appears on the surface anyhow. So I also, Tony had Mr. Weaver had a contact with the police department to where they could perhaps provide us. And would you explain what you found out about that?
Yes, actually I spoke with Captain Mann, who is a captain in the program, and I also spoke to Sergeant Nichols that's associated with that particular program as well. To get some information updates from him, he said that they are willing to come over and train and get Justice Service prepared for the process. We do understand there's a set of letters recommendation letters that have to be completed by Justice Services. Also, we understand that it's some training involved in that too to identify some training instructors that are here at the jail that are willing to be a part of that program. So that's what the director would have to do, identify some people. And the police department is ready to come over to assist and support what we're trying to do over here in reference to the program.
Would you explain what the training actually is, please?
Well, it's actually, you have to have an 8-hour training, and you have to be committed to the training, and they want a direct contact. The ABLE organization wants a direct contact to the people that are part of the training. So if any updates or any modifications made, they want to be able to come in and send information to one particular individual or two individuals that are point of contact for the training program. But they're just not going to let somebody just be a part of the program. They want accountability. There's some documents need to be committed to communicate back and forth to make sure the program is going to be successful.
Jeff.
Yes.
I'd like to make a comment.
Sure.
Once again, this ties into my previous comments. Director Burris, I appreciate you looking into ABLE was brought out from the police department to community groups asking for support letters. Those who are not familiar, I would strongly suggest that you Google ABLE and what that training, it's a bystander. It's like policing themselves on the scene. And why this would, I think, is relevant is what I had mentioned to the director is it's great to see our use of force incidents going down and trending in the right direction. But to also help that along is to give some tools. And the training of ABLE would give correctional officers some mentoring tools and afford them to help de-escalate situations that may occur. So de-escalating when tempers are high, when conflict is right there, it doesn't always require a supervisor or a lieutenant or a captain. They can be given tools how to approach a situation to de-escalate it, keep everybody safe, and then to render some support. Now, I'll say this, a part of the component. Part of the convention that I'm a member of, we wrote the support letter because we believe in improving relationships between law enforcement and the community. There's a caveat to this. There's a wellness portion that officers are going to be enhanced with. So when officers are working tired, when officers are being overworked, when officers are having personal issues in their personal lives, those things sometimes bubble up in the workplace. Those things sometimes cause us to have attitudes that are not conducive to the situations in the workplace. So the ABLE program, from what I've read, from what I researched, from what I studied, is a very positive step that I think at some point should be included in the classes so you can build that. And Mr. Weaver, I will assist you in getting the county police to be a little more specific and giving a schedule. Now, it just started, to pick up, but we don't want them to start filling all their slots and not affording. So if you're saying Captain Mans needs support letters or Justice Service needs support letters, Doug, you have my commitment to go out and get other community partners to send those same support letters. Because if it starts to come into a funding issue of who can fund the training, we'll get that money targeted for the training needs of Justice Service. And that's what the county police needed before they got it, was to have community partners that would suggest that this was something we wanted to do in conjunction. And Doug, just so you know, I think the chaplaincy program, the volunteer program, all those folks should at least get some peripheral training, because it'll be helpful again for the correctional facility as a whole. Thanks, Jeff. I'll be quiet. I see you getting impatient with me. I'm done.
No, I'm not at all. I actually was struck by the generosity of your offer to the jail. So thank you. Do you want?
Yeah, and I greatly appreciate it. I had not thought of that being part of the new officer curriculum, but I think that does make perfect sense. And what excites me about it is keep it where at the line staff level where everyone's supportive, yet holding each other accountable at the same time, and where it can be just done at that level and does not need to escalate from there.
All right. Why don't we go to the Justice Services dashboard? Aaron?
Sure. Let me pull it up. Okay. A few updates on both the main dashboard and the supplemental dashboard. First, I want to pull up daily population. And we'll zoom in on the last, let's say, 6 to 8 weeks. As of May 9th, we were at 1039. And as of this morning, we were at 892. Now, this does not include people who are also in intake. So there may be I think about 15 to 20 people there. So the total number might be closer to about 910 or so. But it's just the residents who are in the jail itself. In the last 6-7 weeks or so, we've dropped about 140 people. This is primarily due to the release of all the federal residents. I think 126 of them in that period. But the overall decline is actually a little bit higher than the number of federal residents that left. So there's a small portion of that that's also attributable to the efforts of trying to move people along and get people out.
Aaron, if I could add to that real quick, this
Sure.
is the first time that we have been below 900 in half a year.
Yeah.
And I'm extremely pleased with that. Additionally, while we did remove or have removed 126 federal detainees, that doesn't explain the entire number, and I think much credit of that has to go to the MacArthur Grant for the remaining numbers, where they've done an exceptional job in helping identify people that can be supervised safely out of the community. And that partnership with the Public Defender's Office, with Wesley Bell's office, with various community partners, I think that's getting stronger every month, and I think that's going to help the decline continue.
Sure, definitely. The other thing that I wanted to point out on the main dashboard, some of you may have seen this before this morning, but the average monthly length of stay data has been very odd looking in the last couple months. But I wanted to reassure and actually mention that in a way this is actually a good thing. We think of average length of stay as wanting to go down, and we do like it to go down. But the average length of stay numbers that are shown on this dashboard are the average monthly length of stay for the released residents within that month. So in April and especially May, the length of stay average release for the people who are released was so high, largely because so many of the people who were released were federal detainees, and the people who are federal detainees, in a lot of cases on average, had high lengths of stay. So this may look as though there are people who are staying here longer, but it's actually really it's really showing the success of getting people who had been here longer out.
That makes sense.
Yeah,
That's a backward looking.
Yes,
indicator.
it's for released residents, and there are several reasons that we measure length of stay based on only people who have already been released. One is kind of like industry standard sort of thing, but also secondly, like you can't know somebody's overall length of stay until they're actually gone. So
Right.
it's just kind of a convention. And like you said, Jeff, this is you could take one look at this and come away with the wrong impression, but the fact that those numbers have skyrocketed looking backward is actually not a bad thing at all.
And I'm guessing the success or continued success of the MacArthur Grant could lead to a permanently elevated number there, because if the lower level people are not coming in at all or leaving very quickly, then the remaining residents will probably be higher offense levels, who are probably going to have longer stays, just due to, the longest stays, I'm guessing, tend to be the capital cases. Is that right, Doug?
Yes.
So if numbers continue to decline due to generally higher offense levels being being predominant in the mix of residents, we'll see that number continue to be elevated.
It could, but it also could, if the overall average could also be brought down by a higher number of short-term releases too. So I think it's just the kind of thing. This is it's a tricky metric because what it's measuring is something very specific, and it's imperative with this particular measure to take the data in context and to go back and look to really do due diligence in explaining why the numbers look a particular way each month.
So the people who are released or diverted under the MacArthur grant program, are they all, what's the mix of them being diverted before they ever come versus coming and then being released quickly?
Were you speaking to me? Sorry.
Yes, Aaron.
So with that, I'm not as familiar with the processes that go into place that may like keep them from being like not coming at all in the first place. But I know that when it comes to trying to get people out quickly, like we have weekly meetings with case reviews and lots of stakeholders at the table, public defender and judges and myself and other people from MacArthur and people in the office, and where Tricia prepares cases and we try to go through. They try to go through and pinpoint individual instances of people who could be primed to be released sooner. So that's kind of like one of the main functions.
If it's helpful, I can answer really quickly.
Yeah, Beth.
What Aaron is talking about is the population review team. Those are people who are already booked into jail and are still there to kind of expedite that review. And I think, as Doug said, the group continues to get stronger every day. I'm just very thrilled with all the progress that they have made in these partnerships. One thing I do think the county continue to work on is that true diversion. That's what you're talking about, Jeff. Like, they don't actually even enter the door. There are no real true diversion programs going on. So Wesley Bell's fantastic program still requires people to come into jail and take up a couple of days there. So usually true diversion programs are done by the police. So that could be something that this group or other groups looks at in the future to kind of deal with people in the community before they come here. It may be that the LEAD program with the prosecutor's office does do that in the future, but I know that's still getting off the ground. So we might want to bring them in to discuss at some point. But again, I think that's one place that we could kind of expand in the future, so they don't even take up one day.
Thank you, Beth.
Aaron, or Jeff or Aaron, could I just interject?
Yeah.
Thanks again for all this work, by the way. I think I appreciate the point you're making about the data showing length of stay is for released residents, and I'm not sure if I completely percolated on that earlier, but it does mean that we don't really have anything in the dashboard that says how long people have been there that are sort of current residents, correct?
That is true.
So
that's a oh, go ahead.
And so I realize that that's, in the parlance of what we talk about in academia, that's censored data, but it may be interesting data to know, like if there's somebody who's been there for over 2 or 3 years, I'm just making that up, but it could be an extreme case. It might be interesting to see that. I don't want to perseverate on this and take a lot of time. I know we have a busy agenda, but I think it, in addition to what's presented, you've done such a great job. It might be interesting to know how long the people have been there who are currently still in the jail.
Sure. I've actually done an analysis like that before. And though I would be happy to display those results on a dashboard, I would want to make sure to do it with particular caution, because the number, if you go beyond the people who have been released in a particular month and you hone in on, let's just say you take a snapshot of all the people there today and you calculate the average amount of time, number of days that all 892 people in the jail have been there, that number will be on a vastly different scale than these average monthly length of stay for released residents numbers, because they're so highly influenced by the long stayers. When you take all the releases into account, you're pooling together, the few number of long stayers who have been released within a particular month, but then you're also including all the churn, so to speak, of the ins and outs, the daily releases, the people who are
charged regularly charged. Okay.
Yeah.
I'm sorry, what?
No, just go ahead. I said, yep, I'm sorry, go ahead.
Yeah. Yeah, it's on a very different scale. Like I said, I'm not theoretically opposed to displaying that on the dashboard, but I would definitely want to have discussions about how to title the window, what exactly to show, et cetera. And I'm happy to do that with you all, with the board. But that's a window that it just takes some caution because it could be easily misinterpreted.
Okay, thanks.
Sure, no problem. The last thing I wanted to mention, I know won't take up too much more time, but these bottom three windows have all been standardized with the caption daily snapshot averages by month. This is to try to, there was some confusion over what exactly was being displayed here. In the near future, I also have a document that it's a documentation PDF and that I wrote last month to explain all of the various windows on the dashboard. We are eventually going to put that up on the website in addition to the dashboard links. We haven't done that yet, primarily because the dashboards have been changing so much in the last month or two. They've been very dynamic, and I've been wanting to wait until they're at a more steady state to put them up. But that is something that is in those plans are in the near future to get that documentation up on the website.
Wednesday, the 16th of July.
All right, moving on to the supplemental dashboard.
Oh, sorry.
I wanted to talk about two new windows that we just displayed this week. And we could talk more about this. I think this was on the agenda for later in the meeting, but we decided to add to the supplemental dashboard both a monthly overtime expenditures budgeted versus spent window and a monthly non-overtime salary expenditures budgeted versus spent window for the year of 2021, so that people can see what our target expenditures and actual expenditures are on a monthly basis throughout the year. I think I probably plan on having these be single year windows. So when the calendar rolls over to 2022, I'll probably clear it and start over with a new window because budgets are such an inherently yearly thing. But this is what they look like, and Nathan Hemme, who has all the great accounting data, will I think from here on forward be sending this out at the end of the month, and we'll update this monthly just as I do the other windows.
And on that, I'd like to just say that we're hoping with the continued decline in the census that we'll get a better grip on overtime. We have closed the 5th floor. There are no residents, no staff on the entire 5th floor because of the decline in population. And with new staff coming on, we're hoping that that will help as well. I will say that our combined regular budget for personnel and our overtime budget, when those are combined, we are still under budget for our personnel expenses. It does make more sense to spend it, obviously, on regular personnel and not overtime. And that's one of my biggest tasks, is to make sure that happens. And I think later we're going to be talking about a strategy regarding that.
Great. So just a few more, just really quick points. One is this blank window. We're still in the process of, excuse me, of trying to long-term fill that in with a monthly metric of the ratio of residents in the jail to correctional officers. That was something that had been brought up by the advisory board a couple months ago. We're still looking into getting the data for that. So it has not slipped our mind. It's probably next on the agenda for what's going to be added to the supplemental dashboard. I think before I pass it over to public health, the only other thing I wanted to mention is that we recently got an okay from the people who do data for public health to make the two public health dashboards publicly available on the DJS website as well. So recently, in the near future, we're probably going to hopefully soon have 4 links up on the Justice Services website, the main and supplemental for that we just showed, but also the main and supplemental dashboards for the corrections medicine as well. And hopefully, in addition to that, I can update the PDF documentation that's going to go on the website soon to include all the descriptions for all the metrics on the corrections medicine dashboards too. So that'll be a project for the upcoming future. And I think with that, oh, sorry, Jeff.
I just had one question, one comment.
Sure.
The question was about the visits. Why do you think the visits went down?
The phone systems were down. The green is the video visits. Yep.
Okay,
so there were none.
Any drives coming out of the pandemic and then going down. Okay. That
Right.
answers that question.
Yep.
Thank you. And then my comment, if you'll go back, my comment is just being gratified to see that, although a tiny blip, but, to me, one of the most important graphs that we look at here every month is the use of force incidents, seeing how elevated they were in, summer of 2020, and then this kind of steady decline, over the last year or so, and seeing that number continue to stay low, I think speaks almost as well as anything else to the change of culture that appears to be taking place here.
Great.
So thank you, everyone.
Sure. I think that's all for me. If anybody has any questions, please let me know. For now, I will pass it on to Liz to do the public health ones. And I think I'll probably want to reach out to you all on the board to talk about a few suggestions for the near future for improvements too.
And Aaron, could you stick around in case there's any additional questions later?
Oh, sure. Yeah, I'll be here.
And I'll ask real quick, just Liz, Liz Allen, our new Chief Operations Officer for the jail, will present the data. I'll ask Valerie to make her introduction, even though that's a little further down the agenda before she does that presentation.
Thank you. Yes, so back in December, I think it was, if foggy memory and the passage of time is correct, I had stepped into a different role within DPH that still places me supporting corrections, which I'm really glad about. But we now have a full-time dedicated COO for corrections medicine, and we can't be more thrilled. So Liz Allen joined us just a couple of weeks ago. And Liz, I will ask that you kind of share a little bit about your experience, but I'll tee that up with just saying that Liz comes to us with decades experience in administration and leadership in long-term care facilities. And so the coordination, the connection between our environments is really beneficial. She understands the challenges, the operational challenges, the staffing challenges, and people needs for running a 24/7, 365 care facility, as well as the risks just that are inherently possible with working in our environment. So she's digging in already from the very beginning, and really we can't be more thrilled to have her here. So she'll become the main voice for our board meetings here to share the COVID updates, the dashboard presentations, and other special topics as we go forward. So Liz, please jump in.
Thank you. I am a licensed clinical social worker, a licensed nursing home administrator, and under social work, I ran many social service agencies that ran 24/7. And then I spent the last 20 years in long-term care running nursing homes. And so I am excited to be here and to become part of your team. And Aaron, if you would put up the dashboard for me, I would greatly appreciate it.
Sure. I just wanted to make sure the picture was on you when you wanted to introduce yourself. So.
Oh, that was
There we go.
fabulous. Thank you. Okay, so with this, the information appears to be fairly consistent according to the data that has been presented, except for we have two outliers. Sentinel events. We had two events that the submitter who presented the documentation to report a Sentinel event, upon review, it appears is that there was no actual harm for those two particular events, which is good to know. Yes, we did report, but there was no actual harm that came to the residents. The second area of slides was an increase in safety events. And so that has increased, it appears to be significantly. And that's because we have done education, remedial education, so that the staff are aware of what needs to be reported. We want this information so that we know truly what is going on in our environment and how can we appropriately address any concerns and issues that are happening on a daily basis. So we've refined our SOP for reporting events and hoping that it's going to continue to increase, and it's not something that you should be alarmed about, but we're wanting this information so that we can change our practice of care if it's identified that that's something that we need to do. We are doing root cause analysis for each of these reports that are brought to our attention, and any action that's needing to be taken, we are doing that with due diligence. Erin, could you go to the second set of slides? There you go. And these are the medical conditions that the residents entering into the facility happen to have. And what we're having to address on a daily basis to make sure that we provide the appropriate medical care for each individual that appears. And according to the data, that seems to be pretty standard of the type of medical issues that your residents may have.
May I ask a question?
Sure.
Sorry to interrupt.
No.
So I see the spike in the percentage of provider visits for pregnancy. What is the exact process? First of all, I'd be curious if there's any, if you have any thoughts on that. That's a pretty significant spike. But secondly, I'm wondering if you can explain the process, both from the perspective of, prenatal visits and how frequent they are and, how that works. Secondly, what happens on the day of, delivery and what that looks like. And third, what happens with the baby.
Okay.
I know that's a lot.
That is. But Valerie is going to be able to help me out with that particular, how many births do we deliver and things like that.
Yes, I can shed some information on this. I would say, first of all, from the metric, please keep in mind that this is the percentage. The number, the quantified number, is really so low that that we don't report by number, so that we're not we're not sharing information about the patient that could in any way reflect who that patient is. So we really overall have a very, very low number of pregnant women at any time. The care pathways that each one of them would go through completely depends on what her specific needs are. So all of our pregnant patients are treated by our providers, in addition to the standard nursing care, but the providers will set exactly what that care plan needs to be. We're meeting all of the national guidelines and best practices, obviously, but knowing that the providers have a close connection to the patients, knowing that they are in an environment that is likely not as comfortable as what they might be at home. So the other point that I would say is that we have not.
Oh, you're muted, Valerie.
Thank you. Thank you very much. Let me try that again. What I would say is we have a very, very low number of pregnant women at any given time in the facility. So the metric that we do see here is a percentage, but again, it has been a very low number. All of the care pathways for each individual pregnant patient are developed by the provider for what that individual patient needs. All of the national best practices and care protocols are of course met, but the providers have a close connection and monitoring of any of our pregnant women. We have not had any deliveries at the facility for as long as I'm aware of. And I think that what would happen in that case with the care for the infant at that time would go into a social services connection if that's what was being set up with that particular patient, if there weren't family or things like that. But we've not had that experience.
And there's no shackling during labor or delivery, right?
No, okay. No. The policy that was published by Dr. Page's office a few years ago, all of the security and the medical protocols adhere to that.
Okay, yeah, I wanted to yes. Confirm that. And then it's handled on a case, what happens with the child is handled on a case-by-case basis, depending on the family and the availability of a related caregiver.
Right.
Okay.
And as far as I know, from history, we have not had a patient incarcerated to the time of delivery. Usually what we do see is our patients that come in quite early in their pregnancy.
Okay. I'm sorry to digress. I was just curious. Thank you.
Sure.
Liz, did you want me to pull up anything else on the supplemental medical dashboard?
I don't believe that has COVID. I just wanted to give like a COVID update. Okay. We've surpassed 10,000 COVID tests being given in the facility. Since April of 2020, we've had 164 positive cases, which is remarkable considering your population. The last positive resident was on June the 3rd. We did become aware 2 weeks ago of a positive employee and a potential exposure within the environment. So we did test all of the residents as far as for COVID to make sure that we didn't necessarily have a major exposure to lead to an outbreak. So we have the one COVID positive, and that was it. So that's our COVID update.
Thank you. Yeah, I mean, we've said it almost every month, and Tim has been particularly vocal in saying it, that 164 positives out of over 10,000 tests is extraordinary and has got to be one of the best percentages in any correctional facility in the country, I would think.
Yeah, I'll say it again. Thank you for teeing me up, Jeff. And I was going to ask that question if you didn't report it, and welcome, Liz. It's a great record that the medical staff has and everybody who's involved in that. It's, we all know from even the Missouri jails where we stand out in our positive record. So, and it's we're almost at the point where we want to say we don't want to think about COVID anymore. But as we know, Missouri's at the top of the country right now in the outbreak in COVID, so we probably can't rest assured on this. It's not this part of the state, fortunately, I guess. It's other parts of the state, so we got to stay diligent on this. So I appreciate all the efforts of the health and corrections staff to stay diligent on this. And so we don't have any Delta variants that you know of, Valerie or Emily or anybody or Dr. Khan.
Yeah, I'll add that we're certainly taking the Delta variant concern very seriously at the Public Health Department and within the jail population and protocols as well. So we have had ongoing conversations about what a Delta, we feel confident the Delta variant is here. And so we are very aware of that and thinking about how our protocols kind of align with that and staying strong with those pieces, particularly in the environment in which we recognize a strain that is much more highly transmissible puts a congregate setting at very high risk. So we're aware of those things, keeping strong protocols in place. While we certainly don't have a positive test out of the jail that is confirmed as a Delta variant, that variant testing broadly has been more limited in a lot of ways as well. So we don't have any information to specifically indicate that we have seen that yet, although we do believe that variant is certainly in our community and aware of that risk. So we are keeping a close eye on that. The testing protocols and all of the quarantine procedures will remain strong and in place in kind of anticipation of what that spike could look like in the coming months.
Thank you, Emily. And just one more quick thing, and I know we have agenda items. Vaccination rates, update on that?
I can support that. We're actually updating the numerical information today because we continue to vaccinate twice a week for as a structured path through the facility. And several weeks ago, we also began staffing intake specifically with vaccination nurses so that we can offer individuals the opportunity to get vaccinated as they come in through intake. We know that we have about a 40% rate of folks that come through that get released before being admitted into a housing unit. And so we're trying to make that channel. Frankly, we haven't had a high uptake on that channel specifically, and it is entirely due to hesitancy. And the staff, the clinicians that we staff in that on those shifts are handpicked really because of their ability to educate the patients and use the time frame that they have with folks as they're waiting to go through the rest of the process, the documentation, and just the booking process to really be as present and remindful as what we can, to the individuals and really try to press the importance of it. But we really have had a very low uptake, but we continue to offer that. What I do expect after we finish the full housing unit quantitative updates later is that we'll have probably 5+ housing units that have neared or passed 50% full vaccination. We have one housing unit that for goodness, probably a month now or more has sat at 80% fully vaccinated. And that's even with any of these housing units, we have constant flows in and out of the patient resident assignments in those units. But we have several housing units that are showing quite a strong interest, and then we just keep going back every twice every week to offer that.
Well, thank you for your efforts, and those cool pads that I saw earlier maybe you want to let a little true information through on those pads about to kind of help with the vaccination
Yes, that's a good idea. We
information.
can add some programming there or some messaging. Yes.
Yeah, I mean, it sounds like you're doing what you can, and you've really, done a great effort throughout the whole thing. But thank you for the update.
Okay. Thank you, Valerie. Anything else, Liz, from you? Okay.
No.
Welcome.
Thank you.
Yeah, and look forward to working with you. All right, let's hope the state of Missouri gets it together. I've got a trip next week down to Newton County with a 17% vaccination rate, so I'll be one of those super neurotic, totally vaxxed and totally masked people for that trip. All right, let's move to conversation about the return of programming. Doug.
I'm very pleased to report that on Wednesday, July 14th, we will start our first programming since COVID, and that is with an anger management class. It will begin with 20 residents. It will be done by a group of volunteers. It's a manualized program. The volunteers requested that all of the participants be vaccinated, so that's going to be another incentive for people to get vaccinated who want programming. That will be required. And that will be an 8 to 10 week course. Like I said, it starts Wednesday the 14th for the men, and then on Thursday the 15th, July 15th, it'll start for the women. So we're really seeing some signs of coming out of the COVID. I have to also add that every time that we have polled or asked the residents what type of programming they wanted, anger management is always number one on the list. So that's why we prioritized it.
Well, yeah, great to hear programming is back. Great to hear it's going to be anger management, and best to hear that it's going to be anger management at by popular demand from residents. So thank you. You've already talked about overtime money spent year to date. Do you want to revisit that anymore, or?
Eric, can you go back to that chart just super quickly?
Sure. I am no longer a presenter, so yeah, there we go. Let me see if I can pull it back up. I apologize for the delay. Hang on 1 second.
While you're looking for that, Aaron, I can go on to quickly the next item because it'll only take 30 seconds.
Sure.
That is an update on the forensic audit. I reached out to Maura Farmand, who is the CPA conducting it, leading the team conducting it, and I received a reply back that she is out of the office until Tuesday the 29th, but I fully anticipate that we'll be wrapped up and we'll have a full update next session of the advisory board.
Okay. So we should be good to go here with these expenditures windows. Yeah, so here's the overtime one.
So can you click on the last month to show how much had been spent?
Yeah, overtime spent in May was approximately 217,000.
Yeah, and again, I don't think that's money required, but not well spent. If we get the staff on board to start eliminating that, we're going to be spending our money much wiser.
And then in the non-overtime salary, budgeted was about 1.327 million, with the actual spent being 1.017 million. So in that case, lower.
Right. And one thing I want to add with that is we're going to have a significant increase in personnel demand for going to court. Just 8 weeks ago, a docket that had listed all the court appearances was averaging around 2 pages. The one last Friday was 9 pages of people that are now going through court with the courts open. So we're going to be transporting a lot more people through court. Thank you.
Well, with the exception of that comment, Director Burris, I thought we might be getting better on this because the census had dropped about 140, if I remember right. So I thought that the overtime might, that's not me barking, by the way, but it's I thought that maybe the overtime might get better because of the drop in the census, but what you just said maybe suggests that it won't get better real soon.
No, not till we get some more people on.
Okay.
Sorry, that's my dog barking in the back, Tim.
No problem.
Hey, Director Burris, as you mentioned, that we'll probably have the audit findings next month. Any indication how much this audit cost in total? I know last month it was 89,000. Do we have a total figure of how much this audit?
I did not receive an update, Reverend Ball, and I apologize for that.
Okay, and then I guess similar to what, well, let me ask it this way. Do we know what are the driving reasons behind the overtime?
Staff shortage.
And has there been a real hard look at the way the scheduling was being managed?
Yes, and in fact, we have an overtime committee that I think there were some real positives that came out of that. Again, a group of line officers that came up with some alterations to it. We hope that makes it more in check and more fair. Again, that was headed by Mr. Weaver. You want to share your comments?
Yeah, they gave some great recommendations to the administration team in terms of outlining management. One of the biggest things was that the schedule was not visible. They thought it was being kind of managed unfairly. That is being changed where the schedule will be visible to all the line staff as well as management. So they can keep track of who's being scheduled overtime and where they're going. Because the locker list was one of the things was not present and visible to everyone, but everyone's supposed to have visibility of that schedule here within the next week.
Okay, so were the numbers, again, before I forget, welcome aboard to Liz. I didn't want you to think I just welcomed Skyda. Welcome aboard to the team.
Thank you.
Here's just something that Doug, Jeff, this has kind of been on my mind for a while. That understandingly, when the pandemic hit and all the changes that the jail had to go through, we know that there was overtime already beginning to come into play. Now, staff shortages, I'm not going to give my speech today about staff shortages. My concern is, and will continue to be, about accountability of making decisions. And with the pandemic, I remember the former director stating they have to be a little more flexible because we had to start segregating the population and doing all types of things to keep everyone safe. And back then, we didn't have a vaccination. We didn't have vaccines. We literally had to do some creative, and that's why I always give kudos to Valerie and Dr. Duchette and their team of being creative and being safe. With that said, I'm still scratching my head about the overtime. Now, were some rules changed in terms of policy? I'm hearing things from workers inside that said when the pandemic hit, the way they could do flex hours and scheduling, all that was being allowed. And maybe that might be, I don't know, because I haven't dug in that hard. Maybe that's what started driving it, not just the staff shortages. And it goes back to Mr. Weaver's point of what the feedback has been in the committee. That a select few of individuals were getting an exorbitant amount of overtime. And was that overtime driven because the scheduling wasn't being a little more managed? Or was this a certain group of individuals robbing the bank? And those are some concerns. So I know I'm just talking in some general sense. I look forward to sitting down with you, Scott, and the director, and providing you some insights of what I've been told or what emails I've read about the policies of the county versus what was afforded or allowed by the management group. And this predates you, Doug. It predates you. But I'm just saying that the flow of allowing a certain group of people to get overtime and overtime and overtime, that surely shot up the numbers while it's not being fairly and equitably presented to others. That wouldn't have burned people out. That wouldn't have, we started losing people around that same time. I mean, there's just some things that would show that's another part of an opportunity for us to address. So Jeff, I look forward to some emails exchanges so I can be a little more specific on the concerns about this.
Okay, thank you, Phil. All right, we have welcomed Liz. So let's move on to new business.
I have one thing.
Oh, you have one other thing?
For new business.
Oh, okay.
One thing in new business, I received an email yesterday at 3 p.m. stating that the county council would be getting together to review all proposals on how the money for the American Recovery Act would be spent. And so I fully anticipate that I'll be submitting today the request for the $2 hourly increase, and I would appreciate any support in that matter.
Okay, this is something we discussed at the last meeting. We've talked about who should be in the category from the board's perspective, the advisory board's perspective, who should be included in that proposed raise, which is a $2 an hour raise. I know, Phil, you had raised some concerns about members of the management team who had already received significant raises a year ago, receiving these, and in response to your concerns, the updated proposal coming from the leadership here to the county council has omitted that group and now constitutes only people who are working inside the jail primarily on a day-to-day basis. I think 227 of the roughly 300 people included are, frontline COs. And then the remaining 75 or so are all people who, lieutenants, sergeants, people who are, on the floor.
Pre-trial. Oh, yeah, no, you're right.
Working every day. And so, so I hope, Phil, have your concerns been addressed?
They've been addressed. I'm not going to delay those persons, those COs, who I've always said, I will not delay the discussion any further. I just will preface it with this, that Director Burris, I hope, in light of what I just said about the overtime and the distribution of overtime, that you hold those captains and lieutenants accountable. Because giving them a pay increase, Jeff, still doesn't sit well with me when looking at the numbers of all those sergeants. I mean, come on, folks, let's just keep it real. Sergeants did not exist until last year. And the sergeants are a very integral part. Sergeants and COs deserve that $2 raise. I'm not saying that the lieutenants and the captains do not. I'm just saying that if you look over those numbers of who did receive their increases, I don't know if I really would incentivize that type of management, that type of scheduling. So yes, Jeff, other than those comments, I support that, the most recent. So I'm willing to vote in favor of it, Jeff, if you put the resolution up there.
Okay. Thank you, and thanks for your, your engagement throughout this process. Beth, I think you may have a concern that, that you had raised, and I want to give you a chance to speak on that if you so choose.
Yeah, I support, giving the raises as well, particularly for the correctional staff. My only concern is when we break people who do the same job into inside and outside, I wonder for the case managers if that incentivizes some of the case managers to want to work inside and maybe have people leave the case management position who work with, the pretrial folk. As I know Scott's coming in and going to be working a lot with pretrial, that's an integral part too. And we really need highly qualified staff in that position, and they work, they're really important to keep the community safe. So I guess my concern, like I said, I support raises always, usually, particularly, for this group, but I just wonder if we're going to lose some of the pretrial people who have, worked really hard to go inside because of that pay change. So that's my only concern. I want to make sure we think about some of the collateral outcomes that we might have if we give these raises to some people and not others.
Doug, do you want to speak to that?
I, of course, in an ideal situation, I'd want to include them. The thing that I have to say is the officers who just getting staff to work in the jail, and I think there's been a lot of bad publicity with jails in general, that attracting staff to get in the jails where we've had the issues, especially with overtime. We've not had a need for any overtime in pretrial, but we sure have in custody.
Yeah, so I think while there's, general, people are generally sympathetic to that view, we want this to be narrowly targeted where the need has been most acute. And so the kind of dividing line based on that and based on some of the concerns that Phil raised seem to come most naturally by focusing on those working day to day inside the jail. But I think your concerns are noted and something that the leadership, I think, is going to keep a close eye on. Right. Is there any other? Thank you, Beth. Is there any other discussion about the most recent proposal? Okay, hearing none, I'd like to move that the board formally express its support for this revised proposal. Is there a second to my motion?
Second.
Thank you.
Dr. Smith?
Aye.
Dr. McBride?
Aye.
Reverend Duvall?
Aye.
Dr. Khan?
Aye.
And Dr. Huger?
Aye.
Thank you.
All right. Other new business from board members.
When are we gonna start back in-person meetings?
Next month?
Yeah, I'm assuming that I survived my sojourn to Newton County. Next month is good with me. Does anybody have a strong, objection to that?
Dr. Khan will have to review you before we had that meeting.
Yeah, given the county council's return to in-person meetings, I think it would be appropriate. Yeah, that sounds good. Doug, do you have anything else?
That's all I have.
Okay. All right. Why don't we? Any visitors?
No comments.
No comments from visitors. Okay. The next board meeting. Okay. So I am wondering. Okay, 2, 9, 16, 23rd. So I am out of town on the 23rd of July. And so I am wondering if people might be available for the 5th Friday in July, or the final Friday in July, as opposed to the typical 4th Friday. So that would be July 30th, if there is availability.
Apologies, Jeff, I'm not available due to a family wedding.
Tim is not available. How about you, Phil?
Yeah, but I probably won't be in person.
But yeah, but you won't be in person. Okay, I mean, alternatively, we can stick with the 4th Friday, and do one more via Zoom or via WebEx, and then go back to in-person in August. What about the 23rd? Should we go ahead and stick with the 23rd, but do it one more via WebEx?
I can probably attend, but only via WebEx that day as well.
Okay.
I'm available on that day, either way.
Okay, well, why don't we stick with the 4th Friday, do one more via WebEx, and then plan for our triumphant return in person for the 4th Friday of August, which will be August 27th.
And when we do the in-person ones, is there a place we can project data up on a screen?
Could do the old roll call room. We'd have more room to spread out.
We'll research that and find out.
Sure.
Okay, so we are set for July 23rd and August 27th at 9 a.m. Thank you. And now finally, I am going to move that we go into closed session to discuss legal advice, confidential personnel information, and HIPAA-protected medical information, which we'll have a separate WebEx for. And I believe this requires a roll call to go into closed session. Is there a second for the motion?
Second.
Okay. Dr. Smith?
Aye.
Dr. McBride?
Aye.
Reverend Duval?
Aye.
Dr. Khan?
Aye.
Dr. Huebner?
Aye.
All right.
So
this portion of the meeting, I think, is concluded. We've finished all of our items for the public section of the meeting. So thank you, and we will see you on the separate WebEx.
So did we have a separate